I'm going to visually inspect your abdomen. There is no visible lesions, scarring, herniations, or bulging. Your abdominal contour looks flat and smooth. I'm going to listen to your bowel sounds, starting with the right upper quadrant, left upper quadrant, left lower quadrant, right lower quadrant. Your bowel sounds are present or more active on all 4 quadrants. I'm going to listen to your arteries, aortic artery, right renal artery, left renal artery, left iliac artery, right iliac artery, and also auscultate femoral arteries. There is no audible bruise. On auscultation, I'm going to palpate your abdomen. I can hear tympanic sounds over the center of the stomach where gas is, and dullness over the lateral edges of the stomach where the organs are present. I'm going to lightly palpate, so let me know if you have any tenderness.
No.
Okay. No tenderness, no superficial masses noted, no guarding. I'm going to deeply palpate now. No organomegaly or inflamed colon noted on palpation. I'm going to palpate the liver edges, so take a deep breath for me and slowly let it out. Okay, liver edges are non-palpable and they don't descend below the costal margin. I'm going to assess your spleen. Okay, take a deep breath for me. Spleen is not enlarged and non-palpable. I'm going to assess for rebound tenderness and also Rosvick's sign. Patient was complaining of abdominal pain on the right lower quadrant, so I'm going to press on the opposite, on the left lower quadrant. Let me know if you feel any pain when I quickly release, okay?
No.
Okay, this was a negative rebound tenderness sign, indicating that there is no peritonitis or acute inflammation, as well as a negative Rosvick's sign, indicating that there is no appendicitis as well. I'm going to assess for acute cholecystitis. Okay, take a deep breath for me. Okay, patient did not stop inhaling with pressure, which indicates that it's a negative Murphy's sign for acute cholecystitis. Okay, I'm going to ask you to sit up for me, please. Facing your back towards the camera. I'm going to assess for costovertebral angle tenderness. Okay, no tenderness noted, which means that there is no acute renal inflammation or infection. Okay, I'm going to assess your upper extremity range of motion, yes. Okay, so if you can please bring your chin to your chest, flexion of the neck. Now look up to the sky, extension of the neck. Can you look to one side and the other? Rotation bilaterally is intact, and if you can put your ear to your shoulder, lateral bend is intact. Your cervical range of motion is intact. I'm going to ask you to turn your head to one side and another against my hand. Okay. Okay, and now shrug your shoulders. Okay. Head rotation is equally and strong against resistance, as well as cranial nerve, 11 accessory nerve, and sternocleidomastoid muscle are strong and intact and equal against resistance. I'm going to ask you to sit up for me. Stand up for me. Okay, if you can put your arms above your head, flexion of the arms. If you can bring them down, if you can put them behind your back, extension of the arms. If you can bring one arm across and the other one as well, that is adduction at 30 and 40 degrees. Bring your arms up towards your head, that is abduction of the arms. If you can please touch your scapula with one hand, the opposite one, internal rotation, do that with the other. That is internal rotation. And if you can flex your elbows and put your arms out, external rotation of the shoulders is intact. I'm going to ask you to sit down again. Okay, I'm going to test your elbow range of motion. So you can please flex your elbows, flexion of the elbows, straighten your arms out, extension of your elbows, bring your arm palms up, supination, and then palms down, pronation, which means that your shoulder range of motion is intact. I'm going to test your wrist range of motion. So please flex your wrist down, flexion, like a stop sign, extension of the wrist. Bring your wrist together like this, radial deviation and out, ulnar deviation. I'm going to test your finger range of motion. So make a fist for me, flexion of the fingers, straighten your fingers, extension of the fingers. Open your fingers up, abduction of the fingers, bring them close together, adduction of the fingers. I'm going to ask you to touch your thumb to each fingertip, that is thumb opposition, which is intact. Bring your thumb across your palm on both hands. Okay, thumb flexion and extension is intact. I'm going to test your upper extremity reflexes and light sensation. So if you can please close your eyes for me. First, let me know where I'm touching you.
Left hand, left arm, right forearm, right hand.
I'm going to test for your upper extremity. Your light sensation was intact. I'm going to test your upper extremity reflexes, starting with the bicep. Okay, bicep reflex is intact. I'm going to do your triceps reflex. You can please relax your arm for me. Okay, tricep intact, relax your arm. Okay, now your brachioradialis reflex. Your bicep, tricep, and brachioradialis reflex are intact and strong bilaterally. I'm going to test your upper extremity strength. So first I'm going to ask you to grip my hands. I'm going to test your, squeeze my hands. Yes, sorry, I'm sorry. Okay, flex your elbows, and like this. And I'm going to ask you to shrug your shoulders against resistance, which means that deltoid muscle is strong and equal against resistance. Flex your elbows and pull towards you and push. Your flexion, extension, triceps and biceps are strong against resistance. I'm going to ask you to put your arms down and now push against resistance and bring them up. Your wrist flexion and flexors and extensors are equally and strong bilaterally against resistance. I'm going to ask you to open your fingers and don't let me close them. Your finger abduction is strong again and bilaterally against resistance. You can put your pinky to your thumb and don't let me spread it out. Your thumb position is strong against resistance. I already did your hand grip. Okay, now I'm going to test your lower extremities. First, going to test your light sensation. So please close your eyes and let me know if you can feel my touch and where.
Left foot, left leg, right foot.
Also, let me know if I'm pointing your toes up or down.
Up, down.
Your light sensation is intact and your proprioception is intact as well. I'm going to test your reflexes. Patellar reflex. Achilles reflex. Okay, and then your Babinski. Your Babinski reflex was negative. Your toes did not spread out from contact. Your patellar and Achilles reflexes are +2 bilaterally. If you can please stand up for me, I'm going to ask to bring your. I'm going to ask you to bring your knee to your chest with both. Okay. Knee, hip flexion, put your leg out to the back, knee extension, bring your leg to the side, lateral bend, and knee abduction. And now bring your leg across, the other way, sorry, across, yes, hip abduction. If you can flex your hip and rotate your foot outwards, internal rotation of the hip. Okay, and now do the opposite, rotate your foot inwards, external rotation of the hip. Very well. I'm going to test your knee range of motion, so please flex your knee flexion, straighten your leg out, knee extension. Okay, sit down for me. I'm going to ask you to move your toes up and down. Dorsiflexion and plantar flexion of the ankle are intact. I'm going to ask you to bring your feet in. Okay, inversion of the foot out. Eversion of the foot is intact. Okay, I'm going to test your lower extremity strength. So I'm going to ask you to pull with your legs towards, come closer to me, okay? Pull towards you against resistance and push. Your hamstrings and quadriceps are intact against resistance. Push down against my hands and up against my hands. Plantar flexion and dorsiflexion are intact against resistance. Bring your foot in and your foot out. Eversion and eversion are equal against resistance. And I'm going to ask you to stand up again. Rotate and bend over slightly. Actually, bend over slightly. I'm going to assess your back. I don't see any deviations, lordosis, kyphosis, or scoliosis present. I'm going to test your pelvis range of motion. So if you can please bend out, and back. Your anterior and posterior bend are intact. If you can rotate your chest to one side and the other, lateral rotation is intact. If you can do this motion, your lateral bend bilaterally is intact. Okay, I'm going to test your coordination. So if you can please put your arms in touch with the front and back of your palms as fast as you can. Movements are smooth, balanced, and coordinated. I'm going to ask you to take your left heel and move it across your other leg. Okay, I'm going to ask you to look at my finger and touch your nose and then my finger with nose to finger movements are well coordinated. I'm going to ask you to, actually I'm going to look at you, put your feet together. I'm going to look at you for 30 seconds and then I will ask you to close your eyes and look at you for 30 more seconds. Close your eyes. There is no swaying, no balance loss, which means that it's a negative rhomboids test. Cranial nerve 8, vestibulocochlear is intact. Open your eyes, put your arms up, and I'm going to ask you to close your eyes and stay like that. There is no, his arms are staying steady and there's no pronation of the arms with the pronator drift test is negative. Okay, I'm going to ask you to take your heel and put it in front of your feet and walk. Your balance and coordination is intact. Turn around and walk on your toes, on your like you're tiptoeing towards me, like you're tiptoeing.
Oh, sorry. Like this.
Yes. And then turn around and do it with your heels. Your balance, gait, and coordination is intact. Your movements are well coordinated.